Take a food systems approach and focus on the people who most need more nutritious foods and the markets that serve them, and think about the long term as well as the short term and all forms of malnutrition. A holistic approach, in other words.
Lives of women and children in the first 1,000 days cannot be put on hold as they are going through critical development phases. So we cannot afford to backslide on the health and nutrition interventions delivery.
I think we're clearly in the first phase of what is likely to be a long-term pandemic, and I think we have been focusing on the lockdown, the very acute aspects, but I think we need to think ahead, and I do believe, unfortunately, that this is going to be with us for quite a long time, spreading around the world and affecting families and people who are ill, people who die, and affect families long term, and the health of children that we're talking about. So I think the message, as Karina said, is think long term, not just the short term response, which we have to do, but how do we position nutrition and nutrition programs and nutrition support to families for a very long haul in response to the pandemic, and what is needed even beyond the pandemic to support nutrition. Thanks.
I think the opportunity to invite everyone to join the call to action for the global nutrition and food systems research community, coming together, standing together for nutrition. So talking about momentum, many of us on this panel are have already signed up for this call to action, and we'd like to invite everyone, and the website is noted there.
We commit to learning about all the amazing things that people have already doing out there. And I want to just close by saying thank you so much again for everyone who joined.